Good afternoon.
Yes, good afternoon, doctor.
I am Dr. Ahmed. I am one of the physicians here today. Can I confirm your name?
Yes, doctor. I am Jane, 32 years old.
Nice to meet you, Mrs. Jane.
Yes, nice
Can
to
I
meet you, doctor.
confirm that you have permission to discuss your other condition?
Yes, doctor. I am his next of kin.
Okay. So, what do you know about your father condition?
Actually, doctor, I'm not sure, but my father started to suffer from disturbance in his conscious level, and he became so agitated and so aggressive during the last 6 months. We have uh, seen a lot of doctors, and finally they admit him here in the hospital. And yesterday my brother came to see him, and the doctors told him that he has a genetic disease called Hungtington, Chorea. And actually we don't have anyone in our family who has this disease. So I'm here today to discuss this issue with you because I want to know what's going on.
I'm sorry to hear that. I appreciate your concern. So let me discuss your father condition. Your father, as you said, have a nerve cable condition that called Huntington Chorea. It is some sort of disease that run in certain families, but it might skip certain generations, so you might not remember or recall a close member of your family with such condition.
Yes.
As you said, this condition might have certain symptoms like your father condition, which is some sort of disturbed concentration, some sort of abnormal behavior. All this can happen with such condition.
Yes. Yes, doctor. But what's going on with my father? He will. Do you have a treatment for this?
Okay, I appreciate your concern, but unfortunately, this condition is not a curable condition. But we can give some medication to treat some symptoms or some complaint of your father. We have some medication that might decrease the bad mood or the abnormal behavior in this way. Are you following?
Yes, doctor. But I want to take my father home.
Okay, I appreciate your concern, but could you tell me why you want to take your father home?
I feel that he will be more safe at home and we will take care of him.
Okay, I hear you. But let me assure you that we have to initiate treatment inside the hospital, and the treatment, not only the medication, but we will arrange a specialist doctor to see him like a nerve doctor, and another one for possible benefit from physiotherapy. There is also a psychiatric doctor who will review his condition, so he will get benefit from seeing all this specialist with highly expert in this field. Is it okay with you?
Oh, doctor, I'm sorry about that because I was really planning to take him to my my sister wedding party.
Okay. I appreciate this, but we can discuss this with the consultant and the specialist doctor to see how can we manage this. Is it okay?
Okay, doctor.
So, as I told you, this condition might run in the family from generation to another. So, I want to ask you some personal question about yourself. Is it okay with
Yes.
you?
Yes, doctor. Please.
Okay, what do you do for life?
What do you do for a living? Okay, doctor.
For
I'm a
living.
teacher. Yes, I'm a teacher.
Okay, are you married?
Yes, doctor. I'm married and I am planning to get pregnant very soon.
Okay, do you smoke or drink alcohol?
No, doctor.
Okay, so we have, as I told you, this condition might run in certain families.
Mm.
So you might have what is called the gene that's responsible for this condition, but it might not become apparent at this time. So I think we can refer you to a genetic doctor who can take certain blood sample from you that the same gene as your father. And if this confirmed, we have multiple solution for this. We have certain solutions such as gamete selection of an egg that doesn't contain such gene. Also, as a last resort solution, we might consider adoption as one of the options available uh, for you. Is it okay?
Yes, doctor. Okay. But if
So,
what if I don't want to do the genetic testing? What if I don't want to do a genetic testing? What can I do?
you have the full right to refuse such test, but you can rethink about that, and we can arrange another meeting after you could make your mind about that. I know it is a difficult situation and you need time to think about.
Yes, doctor. Yes. It's very difficult time for us.
I'm sorry to hear that. I understand your feeling. So, do you have any further concern?
No, doctor.
So, let me wrap up. Today, we have discussed your father condition and we have discussed the main way of treatment of your father with the condition Huntington, Chorea. I have also discussed the possibility of doing genetic testing for you and the possible option for getting a child. So, as I told you, I can give you a pamphlet that contains some information about this disease. You can check a website also containing information about this condition, and I can give you the contact number of the clinic. So if you have any further question, you can contact us. Do you have any further concern?
Yes, doctor. What if his father decided that I should have a medical abortion at any time?
Okay. So during pregnancy, there is a specialist doctor who can follow your condition, especially during the early pregnancy. They do some sort of needle sampling of some fluid from that one surrounds the baby, and they can get the information about if the possibility of getting a baby with such disease, so they could take a decision early about such decision.
Okay, doctor.
Do you have any further concern?
No, doctor, thank you.
Nice to meet you. Can I offer you a drive home, or you will manage this?
No, thank you, doctor. I'm okay.
Okay, nice to meet you, Mrs. Jen.
Yes, nice to meet you, doctor. Nice to meet you also, Dr. Ahmed Al-Burai. You have done very well so far, but all a few comments, huh? This is a family disease, so you have to ask her if she wants to invite her partner or her other family members to attend this meeting. Yeah. This is number one. Number two, also, while you are counseling her for a genetic testing, you have to give her some information about the genetic testing, and also you have to invite her to invite other family members to do the genetic testing, because usually in states like the United Kingdom and so on, they need more information about genetic diseases. Okay, so you have to ask her, or if possible, if you can bring also your brothers and your kid and your other family, your uncle and other family members to do this genetic testing and so on. Okay, so the invitation is very important in this case, whether at the start of the meeting or during counseling for the genetic testing. Okay, and you have to know some information about the genetic testing, that you would refer her to a doctor specialized in genetic testing and in a genetic center. And it is just a blood test. You have to tell her that this is a blood test. We are not taking any tissue from you. And you can refuse taking the sample, or you can refuse doing the test, or even you can ask to see the results later on, or the samples would be taken and kept very confidential for scientific purposes. Okay, so nothing to lose if you go and do the test. Even if you don't want to know the results, it is also for the benefit of the whole country. Okay.
Okay.
Then you have, yes, you give her some options if she want to get pregnant, that she can adopt, she can do an embryo selection, she can do an chorionic villus sampling and so on. But regarding the abortion, she cannot do abortion after the first trimester. So it's not optional by the end of the first trimester. You have to know this, and this is also mentioned in the book. Also, at the same time, also the decision of abortion or not in countries like UK is the mother decision. It's not a father decision.
Okay.
And this was an answer for one of the questions that I have already sent long time ago to the GMC, and they answer me like that. Okay.
Okay.
So you have to know this, because you might face this in the exam. So in this case, you have to show a lot of sympathy and empathy and tell her that her father disease is not curable. You have to counsel her for the genetic testing, and you have also to counsel her for getting pregnant. And maybe you ask her that by the end of this meeting, I would like you to invite your husband so that we can discuss this again in details, so that you both can take the decision together rather than taking the decision yourself alone. Okay, like that, because this is a social issue. This is not only a one-man show. It's not one-man decision. Okay.
Okay.
بس فأنت you have to feel like this is a social issue. Sometimes the genetic disease is having a direct or indirect relation with the job and so on. You have also to discuss this, like patients with who are working as for example pilots and so on. You have to discuss this also. And also in such cases, and you have to tell her that if you have proven to have this gene, so this is inevitably will means that you will be inevitably be getting this disease later on in your life. Okay, but the genetic testing cannot detect the severity of the disease, the onset of the disease, and to what extent it will affect your cognitive functions.
تمام.
If you was deep in discussing the genetic testing, I will be also stimulated to ask you more questions, but you was like superficial in discussing it. So if you told her that you have to go and take the sample and this test so she might ask you, what if I found to be having this gene? Could I know when I will be actually having the symptoms of this disease or not? So you have to have an answer for this. You have to tell her that the genetic test will tell you only that you have the gene, and one day you will have this disease, but we cannot detect when it will start, the severity of the disease, and to what extent it will affect your functions, brain functions. Okay?
Okay.
So, doctor, if I was found to be positive for this test, and what should I do? Okay, you have to plan for your life. You have to have a last power attorney. You have to have an advanced directive. You have to find a stable income for you and for your family, and you have to arrange with your life socially and financially. And I will ask the social worker of our hospital to help you, and also make sure that in the genetic center, you will find also a doctor specialized in nerve diseases, a doctor specialized in psychiatric disorders, and also social workers, occupational health workers, and occupational therapists, and all the people that you need will be there in the genetic center. Okay?
Okay.
هو ده كان الدسكشن هيبقى كده. لو انت was يعني I mean deep in discussing the genetic disease, you will find her asking you more about the genetic test and so on. Okay?
تمام.
بس كان كويس، حاجة كويسة خالص. أنا عايزكم تقعدوا بقى مع بعض إن شاء الله بإذن الله، تبدأوا تعملوا حالات، تبدأوا وتسجلوها زي ما احنا بنسجل كده، ابعتوها لي على الواتساب وأنا أقول لكم إيه الملاحظات بتاعتي إن شاء الله بإذن الله.
تمام. شكرا حضرتك دكتور شريف.
أبدا ولا أي حاجة، وأي وقت أنتم محتاجين أي حاجة اي معلومة يعني، اي مراجعة لاي شيء، انا معاكم وتحت امركم في اي وقت. اعتبروني
الله
اخوكم
يخليك.
الكبير، وهتبقى اكتر حاجة تفرحني ان شاء الله لما تعدوا انتوا التلاتة باذن الله يا رب، باذن الله.
إن شاء الله. الله يخليك يا رب.
امين.
ما كان
مم.
كان بيسألني أضمن منين إن ما يحصليش مشكلة من الدواء، كان هيكون ردي إيه؟
ايوه، you will tell him that anyway we will be starting with a small dose of the drug, and we will be closely following you. You will have, because you did not wrap up. I will give you my contact number. Will give you a leaflets and booklets talking about this drug, and also I will arrange another meeting very soon after 1 week or two, so that we can also see to what extent this drug makes you feel better, or if you have any comments about it. مش كده انت كنت عايز تسألني كده يا تسوقي؟ الو.